Hello, and welcome to our discussion on concepts in epidemiology, incidence, and prevalence. The learning outcomes of this presentation are to 1. Understand the definition and clinical importance of the disease surveillance term morbidity, and 2. To understand the definition and clinical importance of the disease surveillance term mortality. Incidence and prevalence are important epidemiologic terms that help us understand and quantify diseases in populations. The term incidence refers to new cases of disease in populations, while prevalence refers to existing cases in populations. Incidence refers to the occurrence of new cases of disease or injury in a population over a specified period of time. Referring to the figure on this slide, think of adding water to an existing pool of water. The water itself would represent cases of disease. New cases are added to the amount of existing cases. New water added to existing water. The image on this slide illustrates another way to think about the term incidence. Think of incidence as new additions to an existing collection of figures. The new addition in this slide is the figure highlighted in the darker color under the magnifying glass. The term prevalence refers to the amount of existing cases for that specific disease in a larger population. Think of the term incidence as related to new cases, while prevalence, again, is related to old and new cases combined. This slide illustrates the term prevalence is directly connected to the quantity of disease. The more common the disease in a population, the higher the prevalence. The less common the disease in a population, the lower the prevalence. The figure on this slide illustrates the concept of prevalence in a population, specifically the prevalence of hepatitis C. All the individuals who are classified as cases for hepatitis C are part of prevalence calculations in that moment in time and are represented in the middle cylinder. All the individuals who are classified as cases for hepatitis C are part of prevalence calculations in that moment in time and are represented in the middle cylinder. This slide reviews the concepts of incidence and prevalence. Prevalence refers to all cases who have a condition at or during a particular time period, whereas the term incidence refers to the amount of new cases of a disease or condition out of a population. Remember, the N in incidence equals N for new cases of a disease or condition, while the AL in prevalence equals all cases of a disease or condition.